Let's talk a little bit about some of the legislation that y'all are working on and also not working on. And I say that because there had been a whiff of a potential of a possibility that Medicaid expansion might be discussed in some form this session. It seemed like there were more Republicans willing to open the door to that. But before we talk about the politics of it, because you are a physician, could you tell us a little bit about what difference you think it would make to have Medicaid expansion? What does that look like for Georgians to say that this would happen in the state? How would their lives change?
I think that the lives of Georgians would change because we would all of us, regardless of what type of insurance we have, would have easier access to care and more affordable quality care. What we see in Georgia is that Georgia has the second highest uninsurance rate in the nation. And how that translates is that Georgia hospitals have to bear an incredible burden of uncompensated care costs, meaning that patients who don't have health insurance still need health care, right? But what happens is that because they don't have health insurance, they don't have access early on, so they delay their care. They wait until it becomes critical. And what happens is that we end up having more critical patients, more complex care, more expensive care, right? And that cost is borne by all of us, right? I think that when we look at the cost of closing the coverage gap and expanding Medicaid, we have to look also at the cost of not expansion. And that cost is what we've been bearing, what we've been seeing for the past 10 years since the ACA passed, and since we've continued to refuse to take this federal assistance that is available to us.
So because there would be billions of dollars, or at least many millions of dollars, coming to Georgia as a part of Medicaid expansion from the federal government, where is that cost borne right now? Is that uncompensated care that hospitals are taking the hit on? Is that insurance rates for other Georgians? That money is being dispersed elsewhere to other people to pay for all this.
That's absolutely right. And you were right that it is billions with a B. That cost is borne by all of us in a number of ways. When a hospital takes on a high burden of uninsured patients, and there's regional variation therein, right? We see it a lot in rural communities, in communities with lower income patients, right? That the hospital often takes on a lot of that cost, because when a patient comes in through the ER and needs care, we have to take care of them, right? Not just because of EMTALA law, which is a federal law that requires that patients cannot be discharged without stabilization and treatment, but ethically, we have to treat patients that need our help, right? So the hospital ends up bearing a lot of that cost. Individual providers end up bearing a lot of that cost because eventually we have to write it off if patients can't pay, right? Patients end up having to pay a lot out of pocket, and those costs are astronomical. Yeah. It's a top cause of bankruptcy for individual patients. And the rest of us, regardless of what type of insurance we have, end up bearing those costs, because that's why we see insurance premiums go up, is this cost is spread all around, right? So I think it's one of those things where people don't appreciate that high level of cost that we all bear, because it is invisible to some degree in a way that other costs are not, right? We don't get a receipt for it. It's not like when you go to Publix and you buy chicken, you're like, oh, it's $3.25 for this. It's a different type of cost, but we all are bearing it every day. And I think we've become maybe inured to it because it has been such a long standing cost, but we see it in the outcomes in our state, that we have very poor health outcomes. I think our access is poor, and we've had many, many rural and urban hospital closures as a result of this untenable cost burden that we bear.
So it's not going to move forward this session, as you know at this point. But do you feel like the movement is toward full expansion? So for instance, depending on how elections turn out this fall, assuming many of the incumbents come back for the session in 2025, do you imagine there will continue to be momentum toward a full expansion? Or with a Governor Kemp in office, is it unlikely that it will continue to move in a positive direction, or what many people think is a positive direction?
Well, look, but I'm not totally ready yet to say that it's totally off the table for this session. And I recognize how that sounds. I know that sounds impossibly jejune or naive to think, wow, we still have a couple more days to pass this. But what I have noted in this session since we've come back is that it's really been more than a whiff of interest in Medicaid expansion. I've spoken to many, many Republican legislators, many who are in very prominent leadership positions, who have openly conceded to me, both privately and publicly, that we have to do this, right? This is an inevitability. We're going to have to pass Medicaid expansion. At some point, we're going to have to close this coverage gap for the good of our state. What we haven't seen is any one leader step up, stick out their neck and say, we're going to do this. Here's the bill. Let's get it across, right? I recognize it's late in the session for that type of bill to materialize. I realize there are rules and there's milestones in a legislative session that preclude these sorts of things. However, what we've seen in the past is that when there is a priority that is important, especially to the majority, there are ways to get things done. And when you write and amend and can suspend the rules, that you're able to do basically whatever you want, right? I want to point to one House bill that gives me this indication that we're still moving in the right direction. And that is House Bill 1339 that was just dropped last week. And it's not as complete a bill as I would love it to be. Basically, it relaxes some of the certificate of need restrictions on opening rural hospitals, rural healthcare entities, opening up possibilities for more psych beds and OB beds in specific. And it nods in the direction of, again, studying the wisdom of expanding Medicaid. That's not my favorite. I think that we've studied it for well long enough. It's been more than a decade. I don't know how many more numbers we need to gaze at to recognize what we all already know, that this is an inevitability. However, at least it continues to acknowledge in a very public way that that these are issues we need to prioritize. So, when this bill crosses over, as I'm certain it will, it does leave open the option that we could enhance it in a way that gives us a little bit more than just studying the issue, but actually acting on it.
Okay, well, you give us a lot to look forward to and a lot to report on. I've written myself a bunch of notes just now. Phone calls
I'm
to
an
make
optimist,
after this.
we have to be optimistic for our patients, right? Because why else would we be here?